This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
I think that our current lifestyles are just not conducive for optimal health and optimal hormonal function. The education we get around women's health and the normal, physiological functions of our body is just terrible. Each part of our body is taken apart and looked at in this really reductionistic way. How amazing would it be if we could go back to this idea where women's hormones and the ebb and flow of her cycle was really revered and honoured?
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Season 2 Expert Series, where you'll meet 24 of the world's leaders in health discussing their passions and what it takes to make a shift.
We tend to be our harshest critics.
We are more than the muscle and bones in our body.
Whoa, that's so opposite of what I was taught growing up.
I would like a call to arms for women to know that their intuition isn't lying to them.
I'm Katherine and this is The Shift. Hi, I'm Katherine, naturopath, author and host of The Shift. In the Expert Series, we share the insight, stories and expertise of each of our amazing experts. We're talking doctors, authors, naturopaths, researchers and thought leaders. You may have heard them on Season 2 of The Shift, where we took snippets of these interviews to put them together in the series for you. If you haven't listened to Season 2 yet, I'd highly recommend checking out Episode 1, which will give you an overview of what constitutes women's hormonal health and a sneak peek into the series. We'll provide a link in the show notes. Dr. Andrea Huddleston is a women's health expert and integrative chiropractor. She's a speaker and wellness advocate with over 15 years' experience in helping women to take back their health. She has a practice called The Wellness Studio in Perth, Australia, and co-hosts the award-winning top-rated podcast Wellness Women Radio. She is often affectionately referred to as the period whisperer by her patients, and we're going to dig into exactly why in this episode. Let's get started. Dr. Andrea Huddleston, thank you so much for joining me on The Shift. To start with, could you please just introduce yourself and tell us a little bit about yourself and what you do?
Katherine, thanks so much for having me. So I am a women's health practitioner. I have always been completely obsessed with women's health. I think my sort of initiation into the world of sort of understanding women's health and hormones was even just as a teenager watching my older sister have things like burst ovarian cysts and my mum having, really hemorrhagic fibroids and all sorts of things. And I would see their suffering and, it was pretty traumatic as a teenager watching my sister lying on the floor sort of trying to pull her ovaries out through her stomach because she was in so much pain. And then just watching all of my friends have all sorts of horrific periods. And you think that's normal. And I was sort of, I think as a teenager, just waiting for, okay, when is it my turn if this is happening to everybody else? So I think that I sort of had this really inherent passion for understanding female hormones and physiology and everything else. And I became a chiropractor and I just started seeing hormonal dysfunction in every single one of my female patients. And so many of them were just completely ignored within the conventional medical system, and I just couldn't sort of handle it anymore. And so I went back to uni and I did 2 master's degrees in reproductive medicine and women's health medicine. And I sort of from there just started really focusing and specializing in this side of women's health. And that kind of transformed, I guess, my practice and the way that I work with women. And I've sort of earned myself the title of the period whisperer from my patients, which is kind of weird, but it's pretty funny actually to see men's reactions to that title, like because they're such literal creatures and they're sort of thinking, but where are you whispering to? And I've literally had men ask me that, which I just think is so funny. So that's kind of what I do and sort of my qualifications. I'm also one half of the Wellness Women, and we have a women's health podcast as well called Wellness Women Radio. And pretty much everything I do is just with this constant obsession with women's health and hormonal function.
I want to go back to a teenage Andrea and observing that stuff going on with your sister, with your mother. How did that make you feel at the time? Do you remember the emotions that you were going through? Was there confusion? Were you asking questions? What was your process?
There was so much confusion because I think that the education we get around women's health and the normal, physiological functions of our body is just terrible. And so when my sister started menstruating, she had really severe hormonal imbalances. And as I mentioned, ovarian cysts, which would rupture and then went on to develop PCOS. I know it was horrific for her, but for me, I was traumatized because you're just waiting for that to then be your reality. And it's like a ticking time bomb. So she was 2 years older than me. And so mum was sort of gearing me up to get my period and would sort of drip feed information to me. And I was mortified that these things happen to your body. And so, whenever mum said, oh, your period's probably coming soon, I would just absolutely reject that idea. And I did not want to hear about it. I did not want to talk about it. I was mortified. So yeah, it was absolutely traumatizing. But I think that that's such a consistent theme for women that we don't really have a good understanding of what normal versus abnormal is. And I think that's why I was just waiting for it to then be my turn.
Yeah, and then what happened?
Well, fortunately, my periods were always easy. And I know that sounds crazy, but it shouldn't be. I was lucky that I was sort of forced to take really good care of my health. And I know that so many people who are sort of in this health space often have their own stories of maybe poor health or something that sort of led them to that journey. And as a teenager, I was diagnosed with lupus or systemic lupus erythematosus. So it's quite a serious autoimmune condition. And at the time, we didn't really sort of understand it very well. And I was quite sick. I had the most amazing health mentors at the time who sort of took me under their wing as a teenager and kind of said, well, Andrew, with a diagnosis like this, you can't really fence it. You have to make a decision, which way you want to look after your body. You either go down the Western medical route and you take steroids and you do these sorts of things, or you sort of look at what the other options that might involve diet and lifestyle and everything else. And I just knew that I didn't want to be sick my entire life. So I think that the health choices I made as a teenager, and I really was my own sort of health advocate quite early on, meant that my periods were easy. I've always had regular cycles. I've never had period pain, and the ebbs and flows that happen with my cycle, I'm able to really easily identify, and I'm able to interpret that as to, okay, is there something I need to tweak with my health? Because, I've got some breast tenderness or maybe I'm feeling a little bit more irritable and emotional this month. So how is that reflecting my overall health and how I've been taking care of myself? And when my patients hear that hormones and periods and everything else don't have to be torturous like what we're sort of led to believe, they think that the woman with no period pain, no menstrual symptoms is like this unicorn woman, but it should be possible for all women.
Yeah, so I can imagine as a teenager getting diagnosed with a progressive autoimmune disease like that, there's one of two paths that you could take, right? Having that right support and going, all right, I'm going to look after my health and go down this, or the other side, which I've seen happen quite a lot, which is the medication, the lack of knowledge about diet, and just sort of progressing down that pathway. How is your journey with that now? What's been the journey for you, and how do you feel like your mindset or the support that you had around you determined where you went with that?
My experience of lupus now is like I kind of forget that it was even part of my history. I'm completely asymptomatic. There's nothing that even sort of taking a really thorough health history of me that would make you think that that was, part of my experience. And yes, if you were to do blood tests, I would still have really elevated, anti-nuclear antibodies and those sorts of things. But there's nothing else that would reflect that I would have lupus. And I think that that has just been because I consistently take, really good care of myself because I have to as well. And as a teenager, initially I was really sick and I missed a lot of school, and even being outdoors in the sun was a challenge for me. And it was just like not the way that teenagers should be having to live their life. So having some really proactive mentors. And also I think my mum was absolutely fully on board with whatever decisions that I was making then, which was also amazing, just meant that I really understood what my options were. And so I think that that's part of that informed consent. I knew that, okay, if I'm making these decisions to take the road less traveled and not go down that conventional medical route of treatment for an autoimmune disease, then I really need to know my stuff and know how, diet, stress, my lifestyle and everything else is affecting my own sort of immune function and my own physiology. So I think that it's quite a novel thing for a teenager to really understand their system that way. But I guess I reap the rewards from that now because I'm completely asymptomatic and haven't had a lupus flare up, for example, for probably, it'd be at least 15 years now, I think.
Oh, wow, that's fantastic. And I mean, I can tell that you're really passionate about empowering people and educating them to take that responsibility and look after themselves as well. With your podcast, your practice, with all of the stuff that you put out there, it really shines through.
Thanks, Katherine. Yeah, it's important. And I think that sort of like my journey, that informed consent and really understanding what your options are and the risks and benefits or the consequences to those decisions and how that will impact not just your health now, but your health journey and that longevity that you have with whatever it might be is so critical to actually being your own health advocate as well.
Yeah, absolutely. Let's talk about women's health in general. How do you see the state of women's health today?
That's such a good question because it's a really tricky one, and similar to what I experienced, as a teenager and watching my sister, my mum, and so many of my peers around me experiencing horrific periods or, PCOS or fibroids or whatever it might be. I think within women's health, we're led to believe that our bodies and the normal physiological functions are designed to cause us pain and suffering. With the woman's body, there's always something that's a problem. So periods are meant to be painful. You get your period, it's supposed to be irregular and horrific, and you're supposed to miss days of school. And then, as a teenager, you're supposed to start taking oral contraceptives because that's just what's meant to happen because we can't handle our own physiology. And we're supposed to be on that until maybe we want to conceive. And then we need, fertility drugs because we can't do that on our own. And we don't understand our own bodies and we don't understand how to, obviously make babies. And then we'll get to menopause, and that will also be an absolutely torturous time. So again, we'll need more drugs and possibly surgery. And then our different sort of reproductive organs are only temporary and we can take them out at will. For example, our uterus is just for making babies or growing cancer. These are the themes that pervade women's health. And each part of our body is taken apart, I guess, and looked at in this really reductionistic, very mechanistic way. The female system is not honoured and revered for this very complicated but amazing functioning system that is so sensitive to, all sorts of things, including our lifestyle, our stress, our diet, and everything else. But if you actually listen to a woman and you actually take, into account everything that they're telling you and the signs and symptoms that they're experiencing, you will be able to see a really clear report card of what is going on with their health. And I think that this is part of what's missing in women's health, is that because our body is just always expected to be problematic, women are told that all of their suffering is normal. And maybe they've drawn the, quote unquote, short straw if they've got, really horrific symptoms, and they're not listened to.
Oh, massive. And I've obviously been in podcast production and going through all of these themes, and I still got goosebumps from what you said, because it is this real ignorance of women's bodies' wisdom, but it is also that conditioning that things are going to be bad. And if that is the mindset that you're growing up with, much like you did when you were a teenager, of going, okay, well, this is my reality, and you're actually prepping your cells for that to happen.
Exactly. And then it's ingrained in us, and we're enculturated just to believe that we're designed for that suffering. And then it's reinforced often by, and again, that conventional Western medical model. And, 4 out of 5 of women's health experts are men. So you're taking advice from someone who can never properly understand what it means to have a healthy, functioning, female body.
Want to look deeper into your own health? Our virtual naturopathic team help people all over the world to shift their health and their lives. We offer a 90-minute online discovery and diagnostic session where you can find out where you're at, why things are happening, and what you need to do about it. Everyone is an individual, and sometimes it can help to have someone break down your journey and see where you need to head next. To find out more, go to theshiftclinic.com and click on Clinic. Why are we seeing a huge increase in things like endo, PCOS, infertility, PMS, irregular cycles, everything in that realm?
I think that our current lifestyles are just not conducive for optimal health and optimal hormonal function. And I think that that's why so many of these conditions are just absolutely skyrocketing, because now women are expected to be everything to everybody. And the amount of pressure that we put on ourselves is just astronomical. And I think that's also why I'm seeing almost in epidemic quantities women coming in with thyroid dysfunction or, Hashimoto's diagnosis, and often after their second child as well. And I see this so commonly, and it's too common for it to be coincidence. And I know that there's something to that. And I think that we're under so much stress and pressure, and we're not allowing ourselves time to, recover and heal. And also we're not supporting our systems the way they need to be. So our diet and our lifestyle certainly isn't conducive for that health and hormonal function too. And we're just not living in a way that is optimal for that hormonal support.
Yeah. Let's talk about pregnancy a bit. And I know that autoimmune diseases, and particularly Hashimoto's, is more common in pregnancy. But as you were sort of mentioning, you're seeing it more in this second pregnancy where the woman has already had to conceive, carry that pregnancy, breastfeed, have all the stress associated with that, and then go into that again. Let's talk about the impact of women going through pregnancy, birthing their babies, being sleep deprived, plus having all of the other pressures and the impact that has on their long-term health.
Yeah, there's just no reprieve from that depletion. And I think, traditionally women would, have babies and look after the household. And, that's not right or wrong. But what it is it's less physiological demand to now when women have 4 full-time jobs, if they've got kids and a husband or a wife or whatever, and plus they're trying to work and also maintain some semblance of themselves, the amount of pressure that puts on them is so huge. And this is why so many women are absolutely burnt out. And we know that our thyroid function is so much dictated by things like cortisol, our melatonin, and our circadian rhythm. So that's part of what controls, our thyroid hormone production and everything else. So when we've got a woman who has had her first baby, is probably not completely recovered from that pregnancy, the delivery, everything that happens postnatally, and probably is still sleep deprived. And then having a depleted system going into a second pregnancy and then a toddler and a newborn, and that constant sleep deprivation and everything else continues, then we've seen, this long-term hypothalamic pituitary adrenal axis dysfunction. And then the flow-on effect from that is now a thyroid that isn't working very well. And when we sort of look at the demand on the system that way, it makes sense why the things start to break down, and often in that order as well. And it just comes back to these women are just really depleted and the demand on their system is just too great.
This is really good conversation because we haven't really spoke a lot about postnatal depletion, because obviously if you've had children, it's such a huge part of being a woman, is this huge transition into motherhood. We talk about it emotionally, like looking at moving from the maiden into that mother and what that means. But physiologically, that's a lot, isn't it?
There is no bigger change to a woman's system than, obviously like birthing a baby, and the entire, obviously physical, mental, emotional, everything change that comes with that. And previously women would have had support and a community or a tribe to help them raise that baby. But now we very much exist in almost like silos where we really are lacking that connection with our community, and for a lot of us, our families as well, because we're so spread out now that so many of us don't have any other support. So it's no wonder that is just so, so hard. And I know that women are really missing that, and we can see that as part of their hormonal function as well. So studies have been done that show that women who have those close, meaningful relationships with their girlfriends, and when they spend time with their girlfriends, it actually increases their progesterone production. So this is part of how we de-stress. So women don't necessarily do that traditional sort of fight or flight stress response like what men do. We actually respond to stress, a bit differently. And women do this thing called tend and befriend. So we are biologically determined to need those close, meaningful friendships and community and connection. That's part of our safety and our stability, but also our de-stressing sort of mechanisms.
What do you think women need to be able to understand themselves better and to understand when they do need help?
Well, I think podcasts like this, Katherine, are just amazing because it's starting the conversation and it's giving them information that I'm sure along the way they're having these aha moments going, I knew this was not right. I knew that I wasn't supposed to feel like this. I knew that this wasn't normal. And it kind of gives them a little bit of that validation and then hopefully that empowerment to seek help from the right kind of support with that. I think women simply just need to be listened to, and actually listen to properly with whatever support mechanisms or practitioners or whoever that might be. But if you are experiencing a system that is not working the way you think that it should be, and whether or not that is you're having painful periods or irregular periods, or you're struggling to conceive, or maybe you've got weight gain that you cannot shift, all of these are signs and symptoms that the body is not working the way it's designed to be. You have to remember we're not designed for a system that malfunctions. So those are all warning signs that something is off kilter and should be paid attention to. I think the menstrual cycle is such a perfect example of women's health, and it should be interpreted that way as well. So analysing and looking at your cycle might be a really good place to start if you are still cycling. And for women who are sort of moved past that midlife transition, menopausal symptoms are a really good example of this as well. But there are no symptoms that are normal with this. So starting to actually take stock of that and then getting support and working with someone who will actually listen to you, I think is a really good place to start.
Yeah, and it's like you were saying, Andrea, it is something that we just need to keep spreading this message out there, getting people really informed so that they can lead the way and women can actually take that power back, that they've been giving away for so long.
Your system is not, as I keep saying, is not designed to malfunction. You are not designed for suffering. So it's absolutely worth paying attention to this stuff. And I have this saying that your health has a greater purpose. And I wholeheartedly believe that if we can just kind of get out of our own way, and if we have a healthy functioning system, for example, if we have balanced hormones or if we have periods that are pain-free or whatever it might be, it allows us to just get on with whatever it was that we feel like we were put on this planet to do, and get on with whatever our true purpose is. And that should be what health is all about, just allowing us to just get on with our own sense of purpose. I really think that women will change the world when when that is the case.
How do you think that we got from a place of women's natural physiology being sacred in a way? So we used to have red tents and celebration of these different life stages like menarche, like pregnancy, like menopause, to a culture where really women are shamed about their period, about their physiology. So there's a lot of shame, a lot of shunning, and a lot of non-belief of them when they're going through stuff. How do you think this has happened?
I think that it ties into this rise of, I guess, the patriarchy. And this is, we're talking about centuries worth of oppression of women. And if you look back into the history of, I guess, the myths around menstruation, particularly when we moved away from pagan rituals and religion to more sort of Christianity, that is when there was a really big shift and fear that started to develop around women's bodies. And this is when women who are menstruating started to be seen as unclean and almost as those heathens. And then rituals around sort of segregation and seclusion of women who were menstruating started. There were things like we couldn't touch food, we couldn't prepare food, we couldn't be around certain people when we were menstruating because it wasn't understood. And I think that because we had the potential to be literally the givers of life, I think that there was a huge element of fear there. So if there's that suppression of that feminine by that patriarchy, I guess, and by those religious sects at the time, then that's sort of how they kept so much control. And those themes are pervasive throughout most religions worldwide. And then we get to, the 1950s when things could have changed, but instead we brought in oral contraceptives. And so I think that this was a really important shift in a woman's biological revolution. So all of a sudden now we have pharmaceutical drugs that actually suppress, again, those normal physiological functions of our system. And yes, it was made under this idea that we can control our fertility and our ability to conceive. But now it has sort of been this ongoing thing where we're just suppressing those normal physiological functions and suppressing hormones and taking our own hormones offline with this element of control.
So what became really clear is as I was interviewing people was this theme of suppression, of women not being listened to, of being told they were crazy, of being medically gaslighted, but also then coming down to, well, where has this actually began? And it is that patriarchy. And if you look at only 50 years ago, your source of health information was you went to the doctor, who was usually male, most of the time, and they would tell you what to do, and that's what you would do. There is this unraveling, I think, and coming back almost to our roots and coming back to this idea of ceremony and celebration and trying to cut through all of the bullshit that's actually getting in the way of that.
How amazing would it be if we could go back to this idea where women's hormones and the ebb and flow of her cycle was really revered and honoured, like you were mentioning in the instances of, the red tents and when tribes would do things like moon bathing where the women would ovulate and menstruate with the full and new moon together. And that was just, a biochemical pheromonal thing that would happen. And they would remove themselves from their men while they were menstruating to nurture each other, to look after each other. The men would see that as a very they would have such reverence for that because it was seen as such a deeply spiritual sort of event where the women could take that time out to replenish themselves and often just reflect and then come back to, the tribe with important messages and information that they need, because that's part of our power. I just think that that's so amazing. It'd be nice if we could withdraw from society for, 5 days a month altogether.
What I would love to talk about is estrogen and progesterone, and particularly their balance in regards to one another. Can you just explain to me the role of estrogen and progesterone in the menstrual cycle and what they do in the body?
So if we look at our period, let's break it up into 2 distinct parts. So from day 1 of your period to the point of ovulation, where the egg is released from the ovary, that is called the follicular phase of your cycle. And that is when estrogen is most, dominant, for lack of a better term. And estrogen is that beautiful feminizing hormone that develops our hips and our boobs and our butt. It gives us our skin that really nice, plump, youthful glow. But it also has far-reaching effects in the system as well. So estrogen is really important for bone density, for our memory and concentration. It also, as it peaks, it softens the lining of the cervix, because at that peak of estrogen in that follicular phase, that's actually when the egg gets released from the ovary. And estrogen is also required for that maturation of that egg before its release. So we get this peak of estrogen at the end of that follicular phase that allows for the ovulation of the egg, so the egg released from the ovary. And then we move into the luteal phase of our cycle, which is that second phase that goes from the point of ovulation back to day 1 of the period. And during this phase, we start to get a decrease in estrogen, and then we get a surge of progesterone if we have ovulated. So progesterone is made in the ovary from something called the corpus luteum, and it's this incredible little organ that grows once a month in women and then completely dissembles itself. So it's grown within the ovary around the follicle that we will ovulate from. And it's just so amazing that a woman's body can grow an entirely new organ and then, metabolize it in 1 month. Like, it just blows my mind. So progesterone is produced by that corpus luteum when we ovulate. And its main role is actually to support a developing embryo until a placenta can take over at 12 weeks. However, its effects are so much more important than that, much more so than just that. So progesterone is a neuroendocrine hormone, which means that it's a sex hormone, but it also really affects our nervous system. And we like to call progesterone nature's Valium, because this should have a really lovely calming sedative effect on our nervous system. So it binds with GABA in our brain, and GABA is a neurotransmitter that calms the system down, and its effect should balance the sort of excitatory nature that comes with estrogen production. So we want that balance of estrogen and progesterone so that we feel good pretty much all month long. And a lot of women are really surprised when I say that progesterone is produced in that second phase of the cycle, and it also has that lovely sort of sedative effect, because this is usually when women are struggling the most emotionally, and they're usually the most irritable. This is obviously when we get PMS symptoms. So I think that there's a really big hint that a lot of that is involved with that progesterone balance. Progesterone is also the hormone that stabilizes the uterine lining. So estrogen builds the uterus, whereas progesterone stabilizes it in that second phase of the cycle. And it also increases our body temperature and has a bit of a metabolic thermic effect on our system too. When it is in balance, it should be anti-inflammatory, it should be pain protective, it should control our fluid levels and everything else.
So what happens when estrogen and progesterone become out of balance with one another?
So normally the classic picture that we see is estrogen excess relative to low progesterone. And the most common cause that we see for this is usually stress-related sort of changes in our hormonal system, because cortisol, our very bossy stress hormone, can use progesterone as building blocks for it. And so cortisol is the one and only hormone that our body cannot live without. So we need to make sure that we've got plenty of that for our day-to-day function. And also because, we're under so much stress all the time these days. So we need to have that continual production of cortisol. And so the body will often rob progesterone to make more of it. And our whole hormonal system has to function like a beautiful symphony orchestra of balance. So if one thing decreases, then something else is going to rise. And that's just how that balance is maintained. So as progesterone decreases, we do get this reflexive surge of estrogen, and that puts us into this estrogen excess state. And then that continual sort of excess estrogen production also then inhibits that progesterone balance as well. When we have that excess estrogen relative to low progesterone, normally we will see really severe PMS. So this is things like once we've ovulated or if we've ovulated, we might have anxiety, we might be really irritable, we might have those big sort of mood changes where we'll be crying at an Oprah commercial 1 minute and then like screaming at our kids or our partner the next second. Often we will get breast tenderness and really like large breast sort of engorgement in that premenstrual phase. We might have a lot of fluid retention as well, and period pain is a really big part of this because estrogen is a very proliferative hormone. So the higher the levels of estrogen without the sort of the balance of and that stabilizing nature of progesterone means that we're growing lots and lots and lots of that dense uterine lining, and there's a huge amount of inflammation that's happening, but we don't have progesterone to balance that. And also estrogen is very much involved with all sorts of different pain receptors as well. So the higher estrogen we have, usually we've got more inflammation happening with that too, but we don't have anything to regulate its function where we need that progesterone to be kicking in because that's suppressing some of those inflammatory chemicals along the way.
What I would love to know is what has been the biggest shift that you've had in your life and what happened? Well, how did it change you?
Two things come to mind. One of them was actually a patient of mine that I had who kind of changed everything for me. And her name was Stacey. And I saw her very early on in the start of my sort of clinical career. And when she came to me, she had the worst case of endometriosis that I had ever heard about or even read in a textbook. And endometriosis being the abnormal growth of uterine tissue outside the uterus, which is under the influence still of our sort of menstrual hormones. And when she would get her period, she would hemorrhage for 10 days a month. So hemorrhage to the point where she would need to be hospitalized. Her pain was so severe that she would lose bowel and bladder control and she would faint. And there is no painkillers that would even touch the sides of that. She had had 11 different laparoscopic surgeries to try and, take care of some of that endometriosis adhesions. She tried every single drug under the sun you can imagine. She was put through so many different drug trials, including like chemotherapy drug trials to stop try and stop that proliferation of endometrial tissue. She was put into chemical menopause, all sorts of things, and nothing changed. And the amount of suffering that this woman went through, like when I saw her, she was in her early 30s. So she'd had about 18 years of just such severe suffering. And there was nothing that medicine could offer her. Like medicine had absolutely failed her. And I just couldn't believe how much someone could suffer. And that's when I sort of made the decision that this is not good enough, that women deserve so much better than this. And that's really what anchored my obsession with women's health and sort of took me back to uni and everything else. So that was a really sort of pivotal sort of moment for me that created that shift. That was probably one of the biggest ones, I think.
Can I ask a huge favour? If you like this podcast, the very best thing that you can do to support us is to leave a review on Apple Podcasts or a rating on Spotify. This will help to push us up in the charts, which gets us into the ears of more people just like you that are also trying to make their shift. The shift! What's something shocking that you've learnt recently?
Right now, I'm a little bit obsessed with the way that men and women respond to pain differently. So I've been going down this rabbit hole of research of how our hormonal system can actually dictate our pain responses, and why men and women have different pain thresholds, and why women who have hormonal imbalances actually experience so much more severe period pain. And yes, the hormone imbalances themselves are involved with that, but it's the way that that feedback mechanism happens with our nervous system that really exacerbates it, and how men as well, particularly if they're under a lot of stress, they'll be aromatizing testosterone into estrogen, and then their pain responses also shift. So when men are stressed, they convert testosterone into estrogen, and estrogen is, for men in particular, is a very inflammatory hormone. And estrogen really drives up a lot of pain receptors as well. So when men are stressed and we start to see that estrogen excess happening in their system, this is when our normal, like stoic men start to develop man boobs and muffin tops, and we'll see lots of inflammatory sort of conditions popping up, and they'll be much more emotionally unstable. And aggressive tendencies in men are actually more associated with that excess estrogen rather than testosterone, which I think is just, absolutely fascinating. And then if we translate that information for women, if we look at a condition again, like something like endometriosis, it's an immune-mediated condition that is exacerbated by hormonal imbalances. And that typical hormonal picture that goes with endometriosis is, again, usually this estrogen excess relative to low progesterone. And when that estrogen goes unbalanced with anything else, then even our excess body tissue, our adipose tissue, our fat, starts making toxic levels of estrogen as well. And all of that drives up all of our pain receptors and our inflammation. So we'll be feeling a lot more pain more chronically as well. It's super, super complicated, the whole feedback mechanism with all sorts of different parts of our brain, but that's sort of the simplistic version of it. Essentially, it's a big inflammatory response that happens that goes unchecked, that just keeps, like estrogen keeps adding fuel to that fire. And then with chronic sort of stress as well, when we've got low cortisol, then we usually see more chronic pain syndromes. Whereas in acute stress, we normally see more sort of acute pain sort of things. So with that, the lower cortisol, so the more sort of adrenal depletion picture that we see, that is usually things like fibromyalgia, chronic fatigue syndrome, all of those sorts of pain type pictures.
If you could give just one piece of advice to someone that wanted to make a shift in their health and their life, what would it be?
Your health has a greater purpose. And, I keep saying this over and over again, but it is so worth actually finding people who will listen to you, the right practitioners for you, who will really help you to unravel or unpack what it is that's going on for you, and give you lots of different options for support that works, so that you can then just get on with whatever it is that you were put here on the planet to do. Like, your health has that greater purpose. It is so worth, investing the time and everything else into getting that right so that you can just move on.
Dr. Andrea, thank you so much for joining me on The Shift.
Thank you so much for having me, Katherine.
There was so much great information in this episode. Let's review some of the key points and what action you can take as a result of it. One of the things that Andrea spoke about, which really hit a chord with me, was how as women we are always expecting something to be wrong with our bodies. And as a result of this, there's this fear around our own physiology and this reductionist approach to fix things. This really needs to shift. Your suffering is not normal. Just because it's common, it doesn't make it a normal thing that you just have to put up with. My hope is, if there's anything that you've taken from season 2 of The Shift, it will be this. You don't have to suffer and just put up with whatever health issues you have. You can make a shift. we need to acknowledge the physical, mental, and emotional strain that having a baby has on a woman in this modern age. Postnatal depletion is real, and some women don't fully recover until their kids are much older, sometimes never at all. When I see a mother who has health issues, the first thing I'm thinking about is whether she is still depleted from pregnancy, birth, and new motherhood. Sometimes we're so busy and stressed that we never have the space to rejuvenate. Learning is great, but action is better. Here are a few things that you could do as a result of this conversation in order to help you shift your health and your life. First of all, get answers. If you're in pain, there is a reason. If your periods are irregular, there is a reason. See practitioners that look at the bigger picture to help you understand what is happening in your own body and why. Think about the way you live your life and how that is impacting your ability to heal. In general, most of us are living very fast-paced and there isn't a heap of space for self-care and de-stressing. Do we need to shift the way you exist in order to make a shift? Lastly, and I know I say this a lot, build a support team around you. Naturopaths, functional medicine practitioners, emotional wellness practitioners, support groups, whatever it takes for you to get support and answers. This is what we do at the Shift Clinic every single day. Reach out if you need support. A huge thank you to Dr. Andrea Huddleston for sharing her passion with us on The Shift. You can learn more about Andrea at drandreahuddleston.com or check out her podcast Wellness Women Radio for a heap of amazing information. If you like this episode, please let us know by sharing on social media and tagging Dr. Andrea and myself, Katherine Maslin, or The Shift Clinic so we can hear what you have to say. Or you can leave a comment on Spotify or a review on Apple Podcasts. In our next expert series on The Shift, we have Dr. Amy Shah, a double board certified integrative medical doctor that specialises in immunology, hormones and gut health. We talk about fasting, hormones and much, much more. Make sure you subscribe so you don't miss a thing.
Coming up on The Shift.
So we are not okay. We are not doing well, and we're not serving our women well. We have a hormonal highway in our bodies. 30% of a modern person's calories come after 8 p.m. You shouldn't be asking your body to do metabolism in the middle of the night. We want women to lead. We want women to be innovative. We want women to take charge. We want women to be at the levels of decision-making in this world.
This series is a production of The Shift Clinic. Hosted by Katherine Maslin. Music and sound design by Shade Furlong. Thank you to all of our experts. For more details on them, go to theshiftclinic.com.
We can be. We must be.
The first generation to end extreme poverty.
The generation most determined to fight injustice
And inequality.
The generation that saves the planet
From climate change.
And this is how we will get it done.
The global goals.
A 15-year plan for everyone, everywhere.
With no one left behind.
The global goals are a framework that collectively help us
Support the health of our people.
And the planet.
At Shift,
we are ambassadors for the global goals.
This project supports global goal number 6.
clean water and sanitation.
Every time you listen
to an episode of The Shift,
we provide a day's access to clean water
for a human in need
in Malawi, Africa.
Water is the foundation to health, and we believe
every human should have access
to clean, healthy water.
So please share this podcast wide
and keep tuning in
so we can impact those who need it the most.